So immune therapy is the hot new topic in colorectal cancer. There was an interesting study that I've been a part of looking at the PD-1 inhibitor Pembrolizumab in patients with Lynch syndrome. Now you'll remember that Lynch syndrome affects about 4% of people with colon cancer. It's an inherited tendency toward colon cancer that is due to a defect in mismatch repair. Patients who have defective mismatch repair have many mutations in their tumors. They're what we classify as hypermutated tumors. Not only do people with Lynch syndrome get this, but sometimes older patients will acquire this through a process called hypermethylation. Now, the study presented by Dr. Dong Lee and colleagues from Hopkins that we participated in used this pembrolizumab in patients with advanced colon cancer who had Lynch syndrome and some who didn't. The study didn't show any benefit in patients who didn't have hypermutated tumors, but it showed tremendous benefit in the patients who did have hypermutated tumors. What I mean by that is there was about a 60% response rate in these very heavily pretreated patients. And I have one particular patient in my practice, a 26-year-old with Lynch syndrome, who came to me in a wheelchair. She's in theater, and within a month she was back to dancing. So I've never personally witnessed the Lazarus effect in my practice, but this patient literally went from near death to back to normal.